So hi David,
Hello.
my name is Christian and I'll be your student therapist for today. So based on my assessment findings, it is my impression that your low back pain is in part due to the hypomobility of your, or lack of movement that is in your right SI joint of your hip. So this may be caused by some of the postural changes that have occurred during your pregnancy, so just by you altering the way you stand. And there's also some tightness that I found in some of your lower back and hip muscles that may also be contributing to your pain. So based off what I've said, like what do you want to achieve after these treatments?
Mostly kind of flexion, like improved flexibility of
Okay.
my hip.
Hmm.
I have a 2-year-old daughter at home, so I also
Yeah.
want to be able to keep up with her,
Hmm.
and also to just being able to stand on my feet a little bit longer. Because right now I'm just getting pooched real quick, and there's a lot of stuff to do around the house.
Hmm. Oh, okay, cool. So we can definitely help you with that. So my goals as a therapist are to be able to help you walk or stand for longer periods of time without the pain that you say you have when you do stand for or walk for long periods of time. And I also want to help you actually keep up with your 2-year-old daughter as well, because they can get kind of rowdy. And I want you to be able to try to like take care of her without having to ask somebody, oh, can you go watch her while I sit down and take a rest for like maybe 5 or 10 minutes. And so I'm actually going to do this by focusing your treatment on certain aspects of your lower back and your hip areas. In other words, I'm aiming to increase the mobility of your SI joint, which is located right where your lower back ends and it switches into your glutes.
Okay.
And I want to also decrease the tightness in some of the muscles around those areas, which in turn will help reduce the pain that you feel. Because some tight muscles will be pulling on other muscles or other bones and stuff like that, making them a lot more stressed than they have to be. And so I anticipate that after halfway through these treatments, you should be able to walk or stand for longer periods of time without that pain.
Okay.
Okay? And after these treatments, you should be able to keep up with your 2-year-old daughter, even maybe pick her up sometimes as well.
Oh, that'd be great.
Okay, so the focus of these treatments are actually wellness and rehabilitation, because I want to get you back onto your feet and feeling better, so you can do those everyday activities that you want to do. The amount of treatments that I have for you is 6, and these treatments will be 70 minutes in length, pretty much once a week.
Okay.
It's a nice, manageable time, and these treatments I will be working on your back, neck, shoulders, lower limbs, left and right, and your glutes.
Okay.
Just because some of the muscles in your lower back attach to areas around your glutes and stuff like that. I just want to let you know. These treatments will consist of your general Swedish massage technique, so muscle stripping, petrissage, effleurage, broad contact compressions on and in the muscles. And I just want to let you know that they will get a little intense sometimes.
Okay.
And I will also give you some self-care that you can do yourself at home. So it'll just help you release some of the tension that you may feel if it starts to come back at home and you can't make it into the clinic, or I'm busy that week or something and stuff like that. Or you weren't able to book. These will just help release some of the tension and may also help you like sleep and stuff like that as well.
Okay.
So that's pretty much all I have to talk to you about. Do you have any questions for me?
No, I
No?
don't.
Cool. Yeah.